Good morning, everyone. Today, we'll be discussing how to write the discussion section of a research paper and identify limitations in a research paper. So the standard pattern is IMRD, the introduction. You start off with the introduction of a research. Why did you start the study? Methods. What did you actually do in the study? The results are what did you find? And the discussion ties all these three IMR together, right? And to say what does it all mean? Right. So it gives meaning to the study results and gives your implications of your findings in the context of the study. And this is the original surgical interpretation, the hypothesis proposed, right? So it's a summary of what are the components of our discussion? Is start off with the summary of the findings. So what are the key findings of the study? Then second could be the discussing of your key points, whatever were the key findings, key points in the study, first, second, third point. And then you go on to the limitations, what cannot be said, and the anticipated criticisms. And then you conclude with your recommendation, what you make of it, right? But to be, I would request you to be a little circumspect about the conclusion from your results, right? So extraordinary claim generally would require extraordinary evidence to be present, right? So to start off with the discussion, you actually go backwards. You start with the conclusion itself. You start with the why. Why are you writing the paper itself? If you identify why you're writing the paper and the conclusion itself, if that is very clear, why, what are you trying to achieve with the paper, then narrow it down, narrow the two or three findings, supporting findings, which drive towards the conclusion, then your work is mostly done. Why are you writing the paper? What message are you trying to give? This should be crystal clear. And many papers have this lacunae, right? So how to find the key findings? It may be obvious for retrospective studies. Generally have an idea of what the results have been and what are you trying to say in the paper itself. But for, let's say, prospective studies and all that, you may need to find the why. Why you're writing the paper? What are the key points of the paper, right? So how to find it? You may go through the results. You may go through tables and literature itself, and the outlier and the key differences are easy points as a starting point to find your key points. And even if you still don't find it, then don't find your inspiration. Go through book and literature, read 4 or 5 articles articles around your topic, and immerse yourself in the topic. You would organically come up with your argument or the why organically, right? So how do you start off? So we've tackle the conclusion itself. You tackle the conclusion itself, and then you start writing the paper, right? So first paragraph, how do you start the discussion section is one of the methods is to set the stage and the introduce the key question that you started off with, right? Answering from the introduction, right? So as an example, just went through the latest GIPS, the article by Ames Patna about informative videos for proxy consent of by parents, right? And the first paragraph itself says, this anxiety is compounded when you have to sign consent about something which you know very little about or have recently learned. So this is setting the stage for the a discussion to follow. And then the marked in blue is a study on pediatric inguinal hernia consent found significantly lower anxiety scores in parents after a consent video. However, randomized control trial did not have the same. So this is what they are trying to say and why the study had been done, right? So this is how they started their introduction, right? So this was the first paragraph, right? Is there any other way? Many want to get directly to the point. No one wants a rambling setting of the stage or rehash of the introduction in the discussion itself. Alternative is just to give the key points in the first paragraph itself. This is probably the most direct way, right? So another paper, 2024, Percutaneous internal ring suturing for inguinal hernia, and the discussion starts with why did we this study reports long-term outcome of children who underwent PERS for inguinal hernia. So why we did this study? That's the first line, and second line says our results demonstrate that PERS is both safe, effective with low recurrence rate and complication, right? So recurrence rate and complication they want to highlight, and those are the key points they have given in the second line itself, done and dusted with, right? So we know we started off with the why, which was the conclusion. We've tackled the first paragraph, which is set the stage and give the key findings, key results in the first paragraph itself. What do you tackle in the discussion? In the discussion, you tackle the key points that you identify. One, two, maximum three key points which you identified in the body, in the initial conclusion section. Those are discussed in the body of the discussions. So which key point to develop first, which key point to develop subsequently, right? So general rule of thumb is more general to specific, simple to complex. The descriptive statistics will be discussed first, or interpretive statistics later, right? And you may use in discussion, it's important, you may use adjectives and qualify easy, very low complication rate, technically easy to perform, parents were happier, children were happy. Those kind of qualifiers you may use in your discussion, right? So you've identified the key points and you've identified the order in which you want to discuss the key points, right? So how to develop the key point itself, right? So it's traditionally been done in uh, four discrete steps. First step is to basically give the result, describe the result that you are highlighting, right? The first line should be to describe the result that you're highlighting. Now, once you've described the result, you have to compare it against the literature. That's the second point. The second step is to compare the same finding against the literature. Then the third step is to explain why the results are what they are. Third step is to explain the result, why the results are what they are. And fourth is to interpret the results, your own opinion or spin on that point, right? So this is how you develop a four-step process of developing a key point. Right. So let's say we've done a study on inguinal hernia, open hernia repair in children, and suppose you find 5% incidence of scrotal edema, and recent meta-analysis suggested a 6% incidence. 5% incidence of scrotal edema is the description of the result itself, whereas the meta-analysis suggested a 6% incidence is the comparison with the literature itself, right? And you write the third line you might write is probably due to a large dissection in the inguinal canal, which is often required, right? So that's the explanation of the result that you have got, right? And fourth point could be the interpretation. So it's you could write it was mostly self-limiting, resolved in 24 hours, right? So that could be the way to develop the key points further, right? And so let's look at the example of percutaneous inguinal internal ring suturing for inguinal hernia. The line marked in how they have developed a key point in one of the paragraph is they've said we observed 8 complications in 6 patients. Complication rate per patient was 0.84%. So that's the description of the result itself. The next line is in a comparison of 1827 patients undergoing open and 478 patients undergoing laparoscopic repair, SAFA found complication rate of 5.1 and 6.9%. This is the comparison of our result of the results of the author against the existing literature, right? The third line, which is marked in green, is we observed a range of complication in our patients, primarily vessel puncture. This is exploration or explanation of the results itself. What were the results, right? The 8 complications we observed The mainly vessel puncture were the main result that complication that we saw. So this was the explanation or exploration of the results itself. And fourth is the marked in red is only one serious complication, that is omental evisceration was observed. So this is the interpretation. You're mitigating it, giving your opinion, giving your spin on the result itself, right? So the developing a point follows these four discrete steps. Now, you've developed a point and you've got two or three points. How does it lead to the conclusion, right? So I took picked another paper from a recent article from JIPS by Dr. Weber Pandey, and they had three used dual coated, right? So antibiotic sutures and silver nanoparticle they coated and compared, espoused the virtues of that, right? So they had three key points where they said challenges and innovations in suture coating. So if we tried to coat, what were the problems that we got? The synergistic effect and wound healing. Synergistic effect and wound healing, which was said, how does it affect wound healing and immunomodulatory properties, right? So all these were the 3 points which were developed, and you can see all these 3 points funnel right towards the three individual lines in the conclusion, what they are trying to say, right? So this is what you're talking about. So you develop your key points, and all these points should lead towards your three main point. There are no extraneous thing at all, right? No extraneous discussion at all. So how to focus just on the key points? You should not divert yourself. You should not loiter around discussing other findings, right? So this another paper in 2024, very good paper which I like by Nigel Hall, Southampton, UK, which they talk about a minimally interventional approach to esophageal atresia repair, right? So the highlight was the minimally interventional approach in the post-operative management. They discussed 186 cases over 20 years with excellent result, right? If we had been writing, we might have very well talked about the birth weight of the baby, the day of presentation, the kind of complication they had, the kind of stricture rate, leak rates, ventilatory status, starting of feed. All there's so many points which we might have developed, right? But Nigel Hall said our key points is not that. My key point is minimally interventional approach to esophageal atresia repair. They did not discuss any of the results itself, right? The results spoke for themselves. They are in the discuss result section. They started with the why. They focus on highlighting the minimally interventional approach. That is fourth thing: avoid chest drain, avoid routine contrast study, start oral feeds early, and avoid central catheter. And that was the thing. They focused only on those things. So this is the way to avoid any distracting statistics in the distracting thing, anything that distracts from the why you are doing the paper, right? So they did not discuss anything else. Focused article, just focus on admission to discharge, and such a influencer paper still had only 10 odd references, and like King Leonidas in 300 said, he removed everything that distracts from his throw. The paper should focus only on the key point which funnel toward the conclusion that you're trying to give, right? Now, once you've done with the discussion, then in between, they have to discuss the limitation, which is the mandatory part of the discussion. It's often a tightrope walk where we identify the shortcomings of your own research, but it should not be brutal enough to undermine the whole study, right? The conclusion and your message should still be left standing after you've done criticizing it, right? So it's distressing for many to write. It's often left for the end. And it's often an afterthought, right? Okay, I have to write a few limited, let's write a few, scribble something down. But it can, and we know it can have a detrimental effect on your paper if you identify your shortcoming itself, but we should use it positively. This is actually a place to answer anticipated criticism, right? So what would your worst critic would say about your paper? So you have to answer that, keeping that, get into his shoes or her shoes and anticipate his criticism and answer them, right? So it could be in the research scope or design, data collection, external factors, statistical analysis that you've done, or reflect on literature and context. But don't try to punch hole in every facet that limitations can be identified in. So in research scope, whether it's generalizable, the study design, RCT, comparative biases, sample size, uh, measurement tools used, ultrasound, data completeness, observer variability, those can be used for identifying limitation. External factor or statistical analysis, whether there are time constraints, resource limitations, any assumptions that you had, or threshold choices and all that can be used as external factors to identify limitation. And literature, further comparative gaps in literature that you can identify could be used for your limitation section. So let's look at a few examples, right? In again a JPS article where they evaluated intraoperative and postoperative pain in children undergoing herniatomy, right? Using night monitors, right? And they said we use general anesthesia and caudal epidural block. However, our findings may not be applicable to other methods of anesthesia, right? Other methods, let's say local anesthesia, other methods. So they basically highlighted the limited generalizability of the paper itself, or the findings itself, right? We go back to the article that we were discussing, PERS, percutaneous internal ring suturing for inguinal hernia, and their limitation section. The first line is it's a retrospective design, right? So this is a limitation identified about the study design itself. Then the second thing highlighted in blue is the patient and procedure numbers are low. So this is sample size limitation which they have identified. Uh, mm, the segment marked in green is basically, they say, is relied on a telephonic survey, right? That's a methodology fault that they have limitation which they have identified. And identified in orange is focus on prospective studies in this area. Should this is a future area or literature gap that is available, right? Um, so they've identified four facets where their research was they were limited in some sense, right? They've answered those criticism, and however, if you look at the wavy line where they have said we report one of the longest follow-up cohorts in the literature, right? That's a way to give backhanded compliments in the limitation section, right? So they have identified four of the major faults, but they have said. Uh, our results and conclusions are still left standing because this is the longest follow-up cohort in literature. So, in conclusion, discussion is an important portion of medical research. It basically reflects your thoughts and compares it to the literature. Must always, always, always start with why you're writing the paper, right? Uh, why, if you identify why you're writing the paper, identify the key points that you want to highlight in the discussion, and then focus only on the things you want to highlight. Cut out all distractions. Then the discussion section will be perfect, right? Limitations are basically a place to answer anticipated criticisms, and but we should never go overboard. And conclusion is basically to re-emphasize it why. You start with the why, you discuss the key points, which all funnel towards the conclusion, which is why, and limitation should be limited, right? Thank you very much.